Hello, this is Doctor Arun Lakhanpal, and today I will be speaking to you about sleep apnea. Sleep apnea can be central, which is generally associated with neurodegenerative conditions, that is after strokes or Parkinson's disease, and is extremely rare. And the other is obstructive sleep apnea, and when people say sleep apnea, they would generally mean obstructive sleep apnea. So today I will be focusing on obstructive sleep apnea, which can also be present along with a few central apnea episodes called mixed apnea. This is not very well recognized entity in India, although it is believed that about 1/3 of middle-aged men might be affected by it. Obstructive sleep apnea is a phenomenon where while you sleep, as your muscle tone goes down, particularly that of your throat, there is narrowing of your upper airway due to the neck muscles collapsing on each other. As this narrowing causes you to breathe harder, the pharynx gets sucked in and eventually closes briefly. The illness of sleep apnea is when the apneic episodes last more than 10 seconds, or if they make you breathe at less than 50% of your normal amplitude, that leads to a drop in oxygen. This drop in oxygen saturation makes your brain starved of oxygen and it wakes up without you realizing it. This causes the muscle tone to return and the obstruction is relieved and you start to breathe normally again. This happens a number of times in an hour, and if it happens sufficiently to drain your brain of oxygen, you wake up as if you haven't slept at all. And then your brain tries to catch up on the sleep and tries to rest during the day, and you tend to fall asleep easily, such as while in a meeting, watching a movie, reading a book, or if you just sit down to rest. And in severe cases, people can nod off even while speaking to others or while driving. And the importance of sleep apnea actually was highlighted following major road accidents. And even today, airline pilots, train drivers, and drivers of public transport who have sleep apnea are not allowed to drive. Sleep apnea is under-recognized, especially in our country, although its effects are now being increasingly recognized. Sleep apnea can lead to increased tendency to have strokes, heart failure, of having metabolic syndrome such as diabetes. It can make your blood pressure hard to control. You tend to put on weight. You remain tired through the day. Your metabolism slows down. If you have any of these symptoms, you must see your doctor, who would exclude other conditions that mimic sleep apnea, such as certain sedating medications, alcohol abuse, thyroid problems, anemia, and then might proceed to do a sleep study, which these days can be done at home, which involves sleeping with a little monitor by your side and bands over your chest and over your tummy, and with sensors around the nose and on your finger and perhaps on the head as well. This will record how you breathe, the pattern of your breathing through the night, and would measure any drops in your oxygen saturation and the movement of your abdomen and your chest through the night. We all have episodes when we briefly breathe less or stop breathing for up to about 5 times an hour, but if it is in excess beyond a certain limit, which the doctor will decide, or if it is associated with symptoms consistent with sleep apnea, you may need to go on treatment, which in the first instance is Cpap therapy, which is a small machine which is tied over your face and nose, and then it pushes in air gently, gives you a feeling like when you are in a fast car with the window open. It may feel a bit odd initially, but over time you will get used to it. This gentle, continuous pressure of air splints and keeps your airways open when you are in deep sleep, and the obstructive events are abolished or minimized. If for some reason you do not get on very well with the Cpap machine, the other therapies that can be tried are a gum shield or mandibular advancement devices, which actually push your jaw forward so that your throat has more room for the air to go in. As a last resort, surgeries are being tried, which are irreversible, although increasingly becoming more successful. But they remain a last resort because they are irreversible. Things that you can do to improve the pressures required on Cpap therapy, or reduce the number of times that you breathe less or stop breathing, is to actually avoid medications and foods or drinks that reduce your muscle tone, such as alcohol, sedatives. Losing weight will improve your symptoms. It may not cure sleep apnea, but will reduce the fat loading around your neck and hence make it less likely to collapse when the tone goes down. You also need to be assessed by an ENT doctor who will look at any other condition that narrows the passage of your throat, such as tonsils, and that might need to be treated or removed should that be the case. So if you have any symptoms which I have just mentioned, you can go on the internet and score yourself on the Epworth sleepiness score, and if you score higher or equal to a 12, then there is a chance that you may have sleep apnea, and it is best to consult your doctor if you snore, if your family has mentioned that you briefly stop breathing, or if you feel tired or wake up with a headache, or if you have excessive sleeping during the day, and also especially if you are overweight. Thank you.